So we absolutely don't have slides, so I'm going to leave Mr. Williams' last slide up. So I guess I'll start.
You can start.
So yeah, I'm Ruth, I'm an ST6, I'm a registrar, so I'm sort of towards the latter 2/3 of my training. We came through a different system to the more traditional consultants, which is a similar system to the one that you will go through now. So I did my F1 and my F2 in Scotland, which is where I trained. I trained in Edinburgh. And then I applied for core training, so 2 years of a core training contract. And my family are in North London, so I came down to the south coast, so around Poole and Bournemouth, and I did 2 years there, rotating between hospitals where I did 6 months of, 3 months of general surgery, or 4 months of orthopedic surgery and 4 months of intensive care, which was ideal. And then I moved to my CT2 and I went to Portsmouth where I did 6 months of colorectal surgery, which was really, really interesting, a lot of laparoscopic stuff. And then I did 6 months of vascular surgery. And essentially, if you guys choose to do any specialty, whatever it be, you will find where you fit. So you will rotate around, especially nowadays, and you will be in a situation where you meet registrars or consultants and you think, that's how I do things. That's how I think, or I like the way that they manage patients, or I like the operations that they do, and you'll find where you fit. And that's what happened to me in vascular. So I found where I fit. And I applied for a registrar number, which is what you guys will then do for your contract. So while I was a CT1 and CT2, I took my MRCS, Part 1 and 2, which is a good tick to have. I did my bits and my audits and my researchy stuff and my teaching and all of this, that and the other. And I got my training number in the West Midlands, which probably still now is the largest training region in the UK, is that right? So it's the biggest training region, which means it's got every single training surgical specialty around the UK, which is ideal, especially if you're training in Warwick, for example, because every specialty that you guys might choose to do or want to do, you'll have access to it in the West Midlands. And some of the best surgical teaching around the UK as well, which is something I've certainly learnt from my colleagues around the UK. When I got to ST3, I knew that I wanted to come out and do some research because that's one of my interests. When I was at uni, I took a year out to do a BSc as well. And I essentially got my research job by emailing people that I knew or who had a good reputation. And I emailed them and I said, I'm looking to do some research. Could I come and meet you? Not an interview, not do you have a job, but could I come and meet you? And one of the people that I went and met was a guy called Professor Thompson down at St. George's in London. And it turns out at that time, there were going to be some jobs available. And I applied for that job and I got a research job. So I went and did my PhD down in George's in London. So I applied for some out of programme research time, which everybody has access to. And that's what I did for 2 years. And then I came back into programme about 2 years ago and rotated in 2 big trauma centres because my interest was in vascular surgery. So in Stoke, which is a major trauma centre that covers, I don't know, 1 million patients or something.
Yep, that's enough.
And then after that came down to Coventry, which is another major trauma centre, which is key for vascular, and that's where I am at the moment. And then, which isn't necessarily what everyone will do, an opportunity came out to move into something called a clinical lecturer post, which is a post which lets you do 50% clinical work and 50% research work, formal research work. And I moved into that in October. And that gives me a chance to pursue my allied interest, which I will hope to continue for the rest of my surgical career, which is clinical research. It just gives you a bit of time to do that, a bit more formal time. Whereas before October, any research that I was doing it in my own time, which maybe, as you've seen from the slides, I mean, there's not much of your own time to do that in. But there is more than one way to skin a cat, and there's more than one way to do lots of things. I went into vascular surgery because that's where I fit, but also because you have access to almost every part of the body. So our specialty basically involves access to blood vessels everywhere what used to be outside the thoracic cavity, so anything inside the thoracic cavity used to be within the realm of cardiothoracic surgery. But with endovascular surgery now, we deal with everything from essentially the left subclavian artery down. So we deal with blood vessels in the neck, in the arms, in the chest, in the abdomen, groins, all the way down to the feet. I'm looking at Barney. But if a general surgical patient develops some major bleeding during surgery, my boss gets called. I get dragged along if I'm lucky. If there is major trauma in ED, that's us. Yeah.
Lots of times.
Yeah. So the joy of vascular surgery is that you are almost a head-to-toe surgeon, and it's really exciting. So it goes from very elective procedures to major trauma, ruptured aortic aneurysms, gross diabetic sepsis. So we do get all the really gross feet. It's absolutely disgusting. They're mainly anaerobe, so they often smell like feces, I must confess. But these people are literally dying in front of you, and it's quite it's insanely satisfying. We've got a vascular surgical room set up next door, so I'll talk to you a little bit more about what you guys might expect if you're coming through at our stage. But I'm sorry, consult.
Thank you for that, Ruth. So many of you done vascular surgery before. I certainly recognize James, because he's with me now. Anybody ever been to a vascular ward or seen anything about vascular? Because I can see all your faces. You're thinking, a few of you there, thinking, God, no, it's not. Yeah, it's great, but it's not. It's not as great as we make it out to be. I started I was a general surgery trainee, and I did vascular as a part of general surgery training for about 14 years. And I've been through all the surgical specialties, except neurosurgery. I've been to everything: breast, colorectal. No offense meant to everybody. I do apologize in advance for what I'm going to say. I've done everything, but with all that, I'm going to tell you that vascular surgery gives you the kind of work which you don't get in any other specialty at the moment. And the reason I say that is because vascular surgery, when I started, people asked me why I wanted to do vascular surgery. I said, oh yeah, I really like this fine, delicate anastomosis. It's great. You just put your loops on and just concentrate on this bit of the body, and that was it. And that was my impression of vascular surgery. But as I moved on in my career, you realize that that's actually a very small part of vascular surgery. At the moment, as Ruth was mentioning, vascular surgery starts from an elective, maybe a bypass procedure that most of you have heard, to an aortic aneurysm, which is a big blood vessel. There's nothing fine about it. It's massive big blood vessel and a big dilatation of the blood vessel that you're fixing. And then you might get called to another theater where there's a bleeding from an artery that you may have never seen before, but you're a vascular surgeon and you'd be expected to sort it out. That was vascular surgery about 5-10 years ago. And now vascular surgery has moved on to encompass a wide range of endovascular. Have you heard of endovascular things? Stents, balloons, angioplasties. A lot of the work that we do is actually not open surgery. It's a lot has been moved on to endovascular surgery, which is like the laparoscopic equivalent of colorectal. It's a minimally invasive. So if you're a vascular surgeon now, you're not just doing open surgery, but you're doing you've got access to, you're repairing big blood vessels, you're repairing small blood vessels, you're doing bypasses, you're doing varicose veins, you're doing endovascular treatment. There's a lot of exciting things that you can do as a vascular surgeon as opposed to just doing open surgery. And you tailor that to your patient. I mean, you look at the patient and you say, yeah, they've got this blockage. You draw the blockage, and it's up to your imagination. Honestly, it's like you could imagine a blockage. You don't need to be a vascular surgeon for it. Yeah, this iliac arteries are blocked, the femoral arteries are open. Right, how am I going to unblock this? Do the bypass from here to there with a prosthetic tube. Don't like that idea. Maybe do a bypass from an artery in the arm down to the groin. You still don't like that idea? You can do an endovascular option. You pass a wire through here to the blockage and stent the whole lot. exciting, isn't it? I mean, there's so much that you can do as a vascular surgeon as opposed to just doing open surgery. And I don't think any other specialty, I'm not talking about cardiology and neuroradiology, in terms of surgical specialty, I don't think any other specialty gives you a mix of doing, uh, I might be wrong, laparoscopic surgery is an exception, but yeah, endovascular and open surgery, you've got all the tools at your disposal as a vascular surgeon, so it's great. But it's certainly a hard road. I mean, it's often people, when I talk to medical students and things, they come to vascular surgery and they say, oh, this is not for me, this is too technical, it's just, I'm just not made for it. You need your hands to be still, and my hands have got too much of tremor, so I can't do vascular surgery. And that's actually not right, because I remember going to, when I was in SHO and I did my first vascular job for 6 months. I thought it's great, and my boss after 3 months said, you can do this femoral anastomosis. I thought it's brilliant, it's like the dream come true, and I just couldn't mount the needle to the needle holder properly. I was like, shit. It's like, God, can I do vascular surgery? And that happens to everybody. So I don't think, as Mr. Williams mentioned, you're not born to be a vascular surgeon. I don't think anybody are. But if you want to be one, everybody in this room can develop your skills to be one. It's not difficult. It's not something out of your reach. And as I said, vascular surgery has moved on from open surgery to endovascular. Endovascular a few years ago in the UK was a very radiology dominated area, i.e. the radiologists were doing endovascular, vascular surgeons were doing open surgery, and that paradigm is shifting. It's a bit slow in the UK compared to North America, but it is shifting. I mean, if you look at our unit, a lot of endovascular aneurysm repairs are now mainly led by vascular surgeons, and I think that will be the future direction of vascular surgery, where vascular surgeons would be doing a lot, the whole breadth of vascular surgery, including open and endovascular. So yeah, it is. I mean, the average time in the UK for a medical, when you finish your medical school, from the time you start your FY1 to the time you take up a consultant job in the UK, the minimum is 10 years, right? If you just fly through everything, average is about 12 years, 12 to 14 years. So it is a long road ahead. But at the end of it, I mean, I did my fellowship in Toronto for a year, so I know a bit of the training program there. People often think North America's training program is fantastic. We're not that. There are lots of good bits about North America, but in the UK, the training will prepare you much better to take up a consultant job. I mean, that's not from me, but the program director that I worked in Toronto had that impression, because you do get a very good mix of supervised training and operating versus letting you go and learn by yourself, which is what Mr. Williams was mentioning about experience. So you get both the training and the experience that you need in those 10, 12 years that you need. So I certainly recommend that if you're thinking that you want an exciting career where you just don't stop at one thing. If you look at the way vascular surgery has panned out over the years, it's changed significantly, where it was all open surgery, big operations, big cuts in the tummy, big cuts in the groins, to you tailor what the patient needs, minimally invasive procedures, endovascular, open surgery on those who are fit and will benefit from it. So there's a lot of exciting innovations in vascular surgery, a bit like cardiology. That CABG is not that oftenly done as it used to be, because it's all stents and angioplasties, and vascular is got that potential to combine both open and vascular surgery, which is really exciting. So yeah, I'd certainly recommend it. If anybody, if you're thinking about it and say it sounds too difficult, it's not. And I can tell that from my own experience. It is all within reach. I mean, it's not something that you can't do. It does take a long training. It does take lots of endurance. That's there with any surgical specialty. It's not, but it's not out of reach. Okay.